radiological views of the paranasal sinus as well as the mastoid. So to start off with questions, the first question is, what is the Caldwell's view? So what does it represent and how is the view taken? Next one is, what is the Rees view? And the third one is, what is the Towns view? So by the end of this video, you will know all these answers. And in the end of the video, there are questions to be answered in the comments as well. So first, we are going to look at the Waters view. Waters view. So the Waters view is nothing but the occipito mental. It is nothing but the occipito mental or the nose chin position view. And here the skull, it appears like this. There is an angle, that is, this angle is 37 degree, and the X-ray beam is from this direction. So what is the structures which are seen? Structures seen include nothing but the maxillary, nothing but the maxillary sinuses. So the maxillary sinus, it is nothing but the main one. And post this, there is also the frontal. There is a frontal sinus as well as the ethmoidal sinus. Next, there is also the sphenoid sinus. So this is nothing but in the open mouth. Next, we move on to the Caldwell's view. So in case of the Caldwell's view, it is also known as the occipito frontal or the nose forehead view. So here the view is taken with the nose and the forehead touching the film. So the nose plus the forehead. What this does is it touches the film. It touches the film, and the X-ray beam is projected 15 to 20 degrees. So the X-ray beam, if you see, it is projected 15 to 20 degrees. It is caudally. And here, just depicting the diagram. So this is the skull, and the X-ray beam is coming from this side. This is an angle which is formed is 15 degrees, and this is nothing but the X-ray detector. So the sinuses which are seen include there is a frontal sinus, and this is nothing but main. Then we have the ethmoidal sinus as well as the maxillary sinus. So it's similar to that of the Waters view. Waters view also we saw the maxillary sinus which is present, and here also we see the maxillary sinus, but the main being the frontal sinus. Next, we move on to the Hertz view. So Hertz view, it is nothing but the submento vertical. Submento vertical. So what happens is the head is present like this. Okay, so the beam will come this way, and the X-ray detector is this, and this is nothing but the X-ray beam. So the vertex is near the film. So the vertex is near the film, and the X-ray beam is projected at right angles. So the X-ray beam, if you see, it is projected at right angles. Other thing to note is that it is projected right angle to the film, from the subventricular to the submental area. So what is seen in this? So we have the sphenoidal sinus, which is seen, and this is mainly seen. So the sphenoidal sinus is seen in case of the Hertz view. It is also known as the submentovertical. Then we move on to the Rees view. So what is the Rees view? Rees view is also known as a lateral oblique. And here there is zygoma, the zygoma, the nose, the chin, and they should touch the cassette. The zygoma, the nose, the chin, it should touch the cassette. And next the X-ray beam. Next the X-ray beam, what we see is it is directed posterior anteriorly, and it is at 40 degrees, and this is 40 degrees to the mid sagittal plane. So what is seen in this is the ethmoidal sinus is seen. This is nothing but the main. Post this, we go to the lateral view. So under the lateral view, we need to know that this is being the skull. So the X-ray beam comes from this direction and the X-ray detector is present here. So in this case, the lateral side of the skull lies against the film. And the X-ray beam is projected perpendicular to the either side. So it is projected perpendicular to either side. And what is seen here is nothing but the frontal is seen, ethmoidal, sphenoid, as well as the maxillary sinus. So what we saw was the lateral view. So here the frontal, ethmoidal, sphenoidal and maxillary sinus was seen. Next, what we do is we move on to the Townes view. So in case of the Townes view, it is also known as the antero-posterior view. So here, assume this is the X-ray detector, and the X-ray beam, it is fired at an angle of 30 degrees. And this is nothing but the AP view. So what is seen in this Townes view? So in Townes view, both internal, so here both the internal auditory canal are seen. Next is it is used in the acoustic. It is used in acoustic neuroma as well as the apical petrositis. Next, we look at the sculler's view. So here, so this is a skull, and the degree formed here is again 30 degrees. So it is nothing but it is also, this is the X-ray detector. So it is the 30 degrees lateral oblique position. So in this sculler's view, what we see is this is the cholesteatoma and the post mastoidectomy cavity. As well as there is the mastoid abscess. Now we'll be looking at the answers we asked initially. So first the question was, what is Caldwell's view? So Caldwell's view is nothing but it is the occipitofrontal view or the nose forehead position. So now we'll just look at the diagram. So this is the skull. So the beam, it is striking at the 15 degrees. This is 15 degrees. This is the X-ray detection. This is nothing but the X-ray beam. So here the view is taken with the nose and the forehead. So the nose and the forehead, they are touching the film. They are touching the film, and the X-ray beam is projected 15 to 20 degrees chordally. So the X-ray beam is projected 15 to 20 degrees chordally. So what is seen here in the chordwells is there is the frontal sinus, there is the ethmoidal sinus, as well as the maxillary sinus. So FEM. So they are the sinuses which are seen. More specifically, the frontal sinus is seen better. So then we move on to the next question. We asked what is Rees view. So in case of Rees view, it is nothing but it is also known as a lateral oblique. Lateral oblique view is nothing but the Rees view. So here what is seen is the zygoma, the nose, the chin, and they should, what is done is they should touch the cassette. And after touching the cassette, an X-ray beam is projected. X-ray beam is projected posterior anteriorly, and it is projected at nothing but 40 degrees, and this is to the mid sagittal plane. So what is seen in the Rees view? Seen is nothing but the ethmoidal sinus. Ethmoidal sinus is mainly seen in case of the Rees view. Next we move on to the Townes view. So what is the Townes view? Townes view is nothing but the AP view, anteroposterior view. And here if you just check the diagram, so here this is nothing but the X-ray detector, and this is the X-ray beam. So the angle formed here is around 30 degrees. So this is nothing but the Townes view. So the angle formed is 30 degrees, and it is used to see both the internal auditory canal. So the internal auditory canal are seen, and it is also used in case of the acoustic neuroma, as well as the apical petrositis. So they are all seen in this. So now we have a few more questions to be answered in the comments. So first question is, what is Kuhler's view? And so we need the answers of how is the X-ray beam given, and what are the structures which are seen under the Kuhler's view. Next question is, what is the lateral view? How is the X-ray beam projected, and what is the structure seen? The third question to be answered in the comments is, what is Hertz view, and what is seen in the X-ray, and how is the X-ray given? That is the structure seen in the X-ray. So we have the Kuhler's view, the lateral view, as well as the Hertz view.